nutrition, community nutrition. So I suppose some of you will have the background that gives you some basic things about nutrition. I don't know if Prof has taught you some things, but I know there has been a lecture on foundation. So that foundation, with that foundation, you have knowledge of some basic things on nutrition. But if I mention any term that you are not familiar with, please write it down, write the term down, and then you can ask questions on it later after the lecture. So though the topic is community nutrition, I want us to take it from the level of what is intervention. Is there anybody here who has been involved in any form of intervention before? I can see that some of you are doctors. Dr. Adekoya, have you been involved in any form of intervention? Dr. Kalabi. This is a postgraduate course. So I expect you to participate. So it will not just be an ordinary lecture. So when the intervention is just an English word that shows that something is done to intervene, to stop a problem. So when we say community nutrition, most of the time is usually a program that is held in the community to solve their problems. So that's why I want us to look at nutrition intervention. And anytime there is a need for nutritional intervention, then there must have been an assessment. So that's the first thing to understand about community nutrition, that it cannot take place without an assessment. So let me assume that someone has defined nutrition for you and that you also know community. So if you join the two together, then that would be community nutrition. And my focus is on the intervention, the program. So the first thing I'm saying about it is that intervention must be based on assessment. You can't just go to a community and say you want to intervene in their nutrition. You want to do something for the members of that community without a prior assessment. Even if you have funding, you can't just go to a community and say, I want to start giving all of you iron tablets because I just guess that they are all anemic. No, there must be a nutritional assessment. And this is important for us so that if for any reason we are thinking of community nutrition in the future, to do it not just at the lecture level, but to actually carry out nutrition in a community, then we must start with assessment. We must always start with assessment. So when we assess, we know the problem, the nutrition problem in that community, and then we can prioritize, know the ones that are of highest priority, especially to the people, because the community, we are dealing with community now. So you must get the idea of the stakeholders in that community, the community leaders, what they consider as their problem, and then you merge it with what you assess in an objective way through research. So just in case anybody cannot remember what is nutrition, before I go on, so it's the science of how food is ingested, digested, assimilated. That's all process through which food goes through in our body is what we refer to as nutrition. And why it's important and why this course is relevant is because it affects health. It affects our health. So in the same way that the food that individuals eat, digest, assimilate, and all the process it goes through affects them. In the community, the nutritional status of individuals will also merge together to become the nutritional status of the whole community. And when you assess, you are able to detect challenges. So if the food they are eating is very high in carbohydrates, and they are not eating fruits and vegetables, then that community, you might have a lot of micronutrient deficiency. The fund that you have or you want to spend on them, you focus it on solving the problem of micronutrient deficiency. When we want to intervene nutrition-wise, please remember that the intervention may not necessarily be food. It may not even involve food. So intervention can be in form of education. It can be in form of dietary changes, changing their habit, even introducing novel foods. And intervention can also be in form of giving them nutrients directly. So it varies. It can be at individual or community level, but this lecture is focused on the community. So looking at the various things that are done, I've mentioned the first one, identify the nutritional problem. But let me say a few things about that first leg of the steps. It's just one line, but it might involve research. I have to go to that community and do proper community entry. You don't just go to a community and start examining them or asking them questions. You must go through the head of that community, the leader of that community. That's what we refer to as community entry. There must also be a proper community mapping to know the landmarks, the important places in the community, so you have a good grasp of the whole community. This is important because in the process, you might discover some resources that will be useful for your work, and you will not need to spend money on it. For example, if your community nutrition intervention or program involves health education, most interventions would involve health education anyway. Even if what you want to give is food, you want to educate them on how to eat the food properly. And you need a hall. The little available funds, you don't want to use it to rent a hall when the palace of the Oba can actually take everybody you want to address. So you must identify the natural resources in that community. And while you are doing the community mapping to know the whole community and the landmarks and important places, this will also give you some ideas about the people, and the process. You might pick up some things that will be important in your diagnosis of the problem of that community. So this first bullet is just to say that for you to know the problem somebody or a community has, you have to move close and walk around, ask questions. You can even do focus group interview, in-depth interview to find out things and at the end of the day, you're able to identify the problem. The next thing is documentation. Having known the problem in the community, then you must document the problem. And that process, you analyze the nature of the problems, the magnitude. Then you identify the groups that are mostly at risk. So for nutrition, which group of people do you think have the highest risk? I want somebody to answer.
Children.
Children, followed by?
We have under 5, yes.
Under 5 children.
Followed by women of childbearing age.
Thank you. Pregnant women. Yeah. Women of childbearing age generally. So it's important to know those things, because in the process, you identify those who are at highest risk, since resources are always scarce. You also obtain other vital information that will be useful in characterizing the problem so that you can know where you are going, and then you get the baseline statistics. For example, if you discover that many of the pregnant women are anemic, they have anemia, and you are thinking you would like to conduct a community nutrition to address anemia, how do you know when you have solved the problem? Or if you have solved it halfway, you need to get a baseline statistics. You need to take the blood of these women, at least get a sample, and find out the average hemoglobin level. Average, so that way, if the average is showing you, or maybe you can decide to use frequency, and then find out what's the frequency, what's the prevalence of anemia. So you are saying how many of these women have a level of hemoglobin that is less than a certain figure that you are interested in, maybe 30. Maybe you are just thinking, okay, if PCV is 30, that's fine. Everybody below it, they can say their name. So if you determine the level like that and you get the prevalence, when you intervene and you conduct your community nutrition program, you come back and measure again.
And you check again.
Check again. So those who are above 30, you know that these ones, they are okay. And then those who are below, you need to find out this, the prevalence of those who are below, who are anemic. Is it now lower than the prevalence before this program started or not? Because it's possible to distribute the blood tablets, and some people hide it, or they give it to their friends or sell it. And you can have, you can even monitor, and where you monitor and you are able to say that, oh, so number of sachets were distributed. That's not enough. What you are interested in is their nutrition status. So you must measure baseline statistics that you can also measure later to find out. Excuse me. So using that anemia, if by the time you measure at the beginning and you measure later, you discover that maybe instead of 60% who were anemia, who had anemia at the beginning, now 70%, I mean 30% have it, you know that your program is successful. Yes. So and that's why, apart from measuring the statistics, you need to state the goals and objectives of the program. What exactly do you want to achieve? Like I said, if you don't determine that what you want to achieve is this, somebody can say, okay, we were able to distribute 1,000 cartons, we have succeeded. We were able to give so number of women in the clinic this particular product, maybe zinc supplement. That's another example. maybe we have distributed zinc gluconate to all the health centers. That can be an objective actually, but you need to ask yourself before the program starts, what exactly do you want to achieve? The program goal is better nutrition status, fine. But what are the objectives? Which particular objective? Okay, this year, the fund, we want to use it to curb anemia. That way it's specific, and then you can even have more specific objectives like the measurements. So the methods, there are different methods used for community nutrition program. Different methods. I don't know why this lecture is changing. So whatever method is chosen will be dependent on the goal and the objective. So if your goal is well stated and the objectives are well stated, that will determine the method that will be used. But I'll run through different methods and we will pick examples so that if this is your objective, then this method will be relevant. If this is your objective, this method, but it's good to know all the methods because most of the time we combine the different methods in carrying out community nutrition intervention. The first one, and I consider very important, is nutrition and health education, because it's possible to have substances, food, in fact, supplements, different things. If somebody is not well educated on the right thing to do, the person may, or the community is not educated, they don't know the right thing, they may still not do the right thing. And when we talk about the nutrition and health education, the first group of people that we're concerned about is the health and nutrition staff. After you have carried out the community program and you are gone, these health and nutrition staff, they are the ones that are always with the people in that community. So if they are not retrained, if they continue with their old knowledge, they would make your people to backslide. The people that you have trained, the people that you have given iron supplements, and you have encouraged them to eat a lot of vegetables, get more iron. If these health and nutrition staff are not well trained, they are not knowledgeable, they are the same people that would tell them not to stress. Don't stress yourself, don't mind them. They don't mean any harm. They cannot give what they don't have. So we have to concentrate on them and train them. Practically, what does this mean? That means we go to the health centers and get the nurses, the CHUs, community health extension workers, even the support staff in those health centers. You know, sometimes you go to a health center and the support staff is posing like a nurse, if possible, pose like a doctor. So all of them must be well trained on your goal and objective. So if your goal is you want to reduce anemia in that community, then all these people must be well educated on the right kind of food to eat, the right kind of food to even plant, to encourage the villagers, if there are villagers, to plant vegetables, if those people that are even in peri-urban areas and have land, to all those things, these support staff, the health and nutrition staff, well trained on every aspect of the intervention so that they can support you, they can help you to make your work easy. And then we train the community, the people, the members of the community, they must be educated too. And remember that the components that affect nutrition is not just food. Even health status affects nutrition. So that's why we talk about nutrition and health education. So the topics of the training, of the education, is not just nutrition issues alone. Issues around immunization is very important for children, and therefore their mothers or caregivers must be well trained, must be well taught about issues on immunization, on hygiene. Hygiene is directly related to nutrition. So there must be health education on infection. If the people know about food, but they don't have health education, they're not well trained on how to maintain proper hygiene. Maybe their source of water is contaminated and they prepare the food with contaminated water and they have infection. Can anybody tell us what will happen to their nutritional status? What will happen to the nutritional status if they have infection, especially the children? Nobody?
Yeah, the nutritional status will come down, as in, like the infection now. Some of them will go into diarrhea, which at the end of the day, a normal healthy child will now be, when you measure her in him or in MWAC, will now be tending towards red or yellow. That's for severely acute malnourished. So
there's something called wasting.
Yeah, that's wasting. Yes.
Yes, that's the word we're looking for.
Okay.
That child might have attained a certain health status, nutrition status in the past, and everybody was happy.
Yeah.
But the child now has diarrhea and begins to pass stool. After a few days, that child loses weight, and the weight for the height attained is lower than expected. So when the weight for height is lower than expected, then that child is wasted, and that nutritional status is already less than expected. It's not within the normal range. What has caused it is not nutrition knowledge, is hygiene. And that's why the health education is very important. The other example is immunization. If a child is not immunized against measles and the child has measles, the lining of the digestive tract is affected. The child is not eating well, whether measles or any infection, it will affect appetite. The child will not be able to eat well, so the nutrition status will drop for that. The child will not be able to digest the food and assimilate it properly because the lining of the digestive tract is compromised. So some level of the nutritional status drops because of that. Every infection is actually a calorie waster. Every disease, every infection wastes calories. So the fact that the disease is there, the temperature is high, is actually wasting food. So the food that should have been assimilated and used to build up the nutritional status of that child is being used up and wasted on maintaining the high temperature. So these are issues that we should all remember. Please make sure you are writing anything that is not on the slide, because these are just explanations to show how important the health and nutrition and health education is. The other thing that is a method of nutrition intervention is food diversification. If you allow people, they will eat only rice, yam, gari, what else? Many people will not even remember to eat fruits. Many people don't like beans. So you notice that it's only the things that people also love to consume frequently that people will also plant. And the cycle keeps going on and on like that. So it's important that community nutrition intervention involves food diversification. New foods must be introduced to people. to plant and to eat. This kind of intervention is what brought about soya beans, why many people now know about soya beans. Some 30 years ago, I suppose soya beans was not celebrated, it was not a, at least I didn't eat soya beans as a child. I didn't even know anything about it as a child. So it's, there'll be many novel foods like that that can be introduced. But I think we should even start with reintroducing our own food. Many people are not even aware of many of our local foods. So we need to pay attention to food diversification. That can be a whole lot of interventions just to introduce foods to people, to plant new seedlings, to introduce novel foods, or to reintroduce foods that were eaten in the past. Many people don't know anything about sweet potato. They don't eat sweet potato. They don't eat yellow yam, cocoa yam. I hope that cocoa yam will not disappear from this country. I hardly see people eat it, and it's nutritious. Food diversification is important. Many people don't eat beans. Many people in this Lagos don't even know that white beans exist. And white beans is very good, is less acidic compared to the other types of, not all types anyway, but compared to the red beans. Green beans is, and green peas is alkaline and is very nutritious. So diversify, that's number 2. Food supplementation. This means that we want to introduce additional food items or nutrients to people, to target groups, so that we can improve their nutrition status. Please remember that people usually confuse food supplementation and food fortification. But the way to remember the difference is that fortify is just an English word. You can fortify, it sounds like reinforce. You want to reinforce, you want to fortify, make stronger. That word connotes that there is a particular thing that is existing that you want to make stronger. So always remember that food fortification involves adding micronutrients to minerals and vitamins. I hope you know micronutrients. Micronutrients are the nutrients that are required by the body in very minute amounts. They are minerals and vitamins. But though they are required in minute amounts, they are very important. If they are not available, a lot of processes going on in our bodies that we're not even conscious of can be altered. They can be affected because those minerals and vitamins are not available. They are very important in digestion of the macronutrients, for example. So that means if somebody ingests a lot of macronutrients in form of carbohydrates, protein, and fat, and does not take sufficient micronutrients, even the digestion and assimilation of the macronutrients will be affected. So it makes this micronutrient to be very important. I don't know if somebody will teach you along the line, but please write it down that when micronutrients is deficient, it's called eating hunger. Eating hunger. So if you find such a situation in a community, then you already know that one of the methods that you will use is food fortification. What micronutrient is lacking? Let's assume it's vitamin A. Okay, these people don't have vitamin A. What can we do? Before you start thinking of manufacturing vitamin A, the first thing to think of is what food has a lot of vitamin. Anybody, do you know the food that has high amount of vitamin A?
Palm oil.
Thank you, palm oil. I like this
Carrots.
Carrots. So that means
all those yellow colored vegetables.
Yes, purple.
Mango.
Carrot, mango, palm oil. Yes. So let's take palm oil now. So let's assume that you are interested in increasing the vitamin A consumption of the people in the community, and you want to fortify food. You want to use this method, food fortification. You can add palm oil to garri. You know that these people, they like a lot of garri. So you add palm oil to it, it becomes yellow garri, and they are getting the palm oil from the garri. I suppose part of it will be lost in the process of frying, but at least some will remain.
Some will remain,
Some
yes.
will remain. Beverages can also be fortified with vitamin A. But if it's a community where they take palm oil, maybe all you need to encourage them to do is just to take their palm oil and not throw it away. You know, we are in a funny situation now. People will throw away their palm oil, they leave it, and they'll go and buy Mamado, that is refined palm oil, palm olein, refined palm olein. It's a paradox. They throw away all the vitamins and package refined oil, and people now use their money to buy it, and they think red oil is local. So we can educate them, and then we can put them through, or we can fortify their food. So in some situations, you cannot fortify with another food like palm oil. You need the micronutrients itself. And an example is salt that has been fortified with iodine. But please let me state here that if people are using salt, they should ensure that that salt is not exposed. If people are still buying salt that is exposed in the market because it's cheaper, it's punishment, because iodine actually evaporates when the salt is exposed. So that's important. So now we know the difference between food fortification and supplementation. Fortification means we fortify food. Supplementation means we give the supplements separate. So it's provision of additional food items to target groups. And the way you will never forget this is iron supplements. You know that pregnant women receive iron supplements. So any other person can receive supplements. Adolescents can be given calcium supplements if they are not getting enough. And we know that after that stage of adolescence, there's no other opportunity. We can give them calcium. We can give pregnant women calcium supplements too. We can give pregnant women folic acid supplement. Can anybody say the situation that warrants folic acid supplement, necessitates folic acid supplement? Doctor?
Pregnancy.
Neural tube defects.
Neural tube defect. Thank you. So it's possible to pick it up before it causes problems. But I suppose many people don't even know they have folic acid deficiency until they have a baby and that baby has neural tube defects. So in that situation, that woman must be receiving folic acid supplements before another pregnancy. Immediately you notice that woman must go on folic acid supplements and continue until maybe 4 months or 5. I can't remember the specific figure now, but the person must be on folic acid supplement before and during a subsequent pregnancy. So we should not wait until the person gets pregnant. You know, for an average woman, you wait when the person is pregnant, and maybe 3 months, you now start folic acid supplement. But for such women, they must start before they get pregnant and continue in that pregnancy for some months. So another method that is used for community nutrition is treatment of cases. So that means in this situation, we identify people who already have challenges and we treat them. So let's leave anemia for now and go to obesity. Obesity is a nutrition problem, you know. If you go to a community and we measure their weight and height, adults, we measure their waist circumference, hip circumference, and after all the measurement and analysis, you discover that 25% of women are obese, 20% of men are obese. That will require attention. It will require attention. So we do not just think of, we just give them health education and go away. No. Some of them actually, because some of those people are obese, some of them would have developed high blood pressure. So we need to treat them. Get them to the clinic or health center and prescribe treatment for them. The reason is that if they are not treated, they will continue to add to the prevalence of those who have that problem. Many of them will still spring up anyway. So if you discover this kind of problem during your investigation, during your assessment, then you know that it's already a problem. Treatment of cases must be one of the methods. Definitely, health education will be a method. If it's obesity, let's look at all the methods that will be required. That's a practical way now. So let's assume that we've gone to the community. We've discovered that 25% of them are obese. Another 30% are overweight. And this is the reality. This is about the figures we're recording now. But we are not following, we as health experts and the government and the people that make policy, we're not following proper community nutrition, because ideally, these are things we should do. One, there should be health education. On TV, on radio, everywhere, people should be educated against obesity. Two, food diversification is important. This method is relevant too. Instead of eating rice, jollof rice every day, people should be, we should introduce foods like oats, corn, foods like yellow yam, sweet potato. I remember when I was, when I discovered that I was obese, seriously obese, and decided to work on myself, I switched from yam to sweet potato. I ate sweet potato for almost 2 years, every day. Sweet potato and vegetable almost every day until I conquered that problem. So, but some people don't even know, they're not even thinking, it's not in their thinking that food, sweet potato, and I was eating white beans, not red beans, and I ate beans every day too. Sweet potato every day, beans every day. So people can be, food diversification is relevant. Supplementation is not relevant in this situation, because what somebody that is obese needs is not supplementation. So that one is not relevant. Fortification is not relevant in this situation. But treatment of cases is relevant, because there are some people that are morbidly obese and they will need treatment. You need to go beyond just talking. Just say, hey, do your exercise, eat. They may actually need you to prescribe some things for them. But it doesn't have to be drugs. You can prescribe smoothies, different types of smoothies that they can be drinking every morning to overcome it. But some cases, maybe pregnant women who are anemic, if that's the situation that is most prevalent in the community, may require iron tablets, may even require some injections or infusions. Other conditions will require highly specific medical attention to be provided. So now, I haven't treated people who have cases. You can't go away like that. Some cases will soon develop. Some that have developed will become worse. But the new ones, we want to prevent new ones from developing. As we are treating the ones that already have the problem, we also want to prevent it in the community. And that way is food. That is agricultural production. So we need to, you see, people that have problems can't really solve their problems. And that means is health workers, governments, NGOs, people that are concerned that can help people solve their problem. So when people need to eat certain kinds of food, that has to be introduced to them. Some of them are farmers, but they can't afford, they don't have the resources. Excuse me. So they may need to form cooperative societies where they can pull resources together, and they may need the support of departments of agriculture, like Ministry of Agriculture at the state level, at the federal level, to encourage them. They can give them tractors, they can rent tractors. If a cooperative society rents a tractor and the tractor works on all their farms, might be easier for them to pay than individuals getting such tractors. Whatever can be done to encourage people to produce more should be done. And I think one of those things is to ban importation of some foods so that people learn to eat locally available foods and encourage agricultural production. Encourage cooperative societies, and then look for ways to improve the economic status of the individuals and communities. Because if economic status improves, people will have more option and they'll be able to do the right thing. There was a time that I couldn't afford to be taking oats, the old-fashioned oats all the time. But now I can take it and it's helping me to control my weight, to maintain my weight. So income is very important. And then nutrition status monitoring. Periodic assessment of the prevalence or specific conditions. So we need to keep monitoring the nutritional status. Remember that when we establish a program, we conduct a program, any community program, we get the baseline, then we make sure we continue to monitor during the program, and at the end, there will be evaluation. So that periodic assessment is very important. So if it's anemia, you keep assessing, monitoring the current state of hemoglobin or PCV. PCV is packed cell volume. Follow up to identify the need for and receipt of other primary healthcare services. So we are at the end of this program now. We want to evaluate. So that evaluation means that we are checking to what extent has our objectives been accomplished. So when we achieve our objective, we say that we have been effective. This is our objective, and we have achieved it, we are effective. But it's also important when evaluating to check whether we use the appropriate amount of resources to conduct the program, because it's not enough to achieve the objectives. It's also important to manage resources. So if we manage resources well, then we can say that we have been effective. That's the difference. And the levels, we also can assess the levels of improvement. Maybe it's just 2%. The anemia dropped by just 2%. We don't need to clap for ourselves too much. But if it drops by 20%, we are happy. The proportion of those eligible who are actually receiving services matters. Like I said, how many people receive the iron tablets, how many people receive the zinc tablet, how many people signed up to be drinking smoothie and eating sweet potato to manage, or to sign up for exercise to manage obesity. Those things are important, but ultimately, what we want to achieve, that nutritional status, is what is most important to us. So we must check if anemia is what we are tackling. The proportion of those with anemia who received treatment, the proportion who received nutritional, and then the proportion who stopped having anemia after the intervention. The extent of success depends on how much the objectives are achieved. So an example is prevalence of iron deficiency anemia. If it's reduced by 20%, as opposed to the targeted 25% in the first operational year of the program, we can say that the program is judged to be 80% successful. So you see why it's important to set a goal at the beginning. This is the goalpost. So when we get there, we'll know. If you don't get there, we'll know. So if we are targeted 25% drop in iron deficiency anemia at the beginning, and we got 20%, not too bad, 80%, we can always improve on it. But I mean, also remember to assess cost. Like I said, that's what will help us to determine our efficiency. Does anybody have any question at this time before I close? Question? There should be a score for asking questions and contributing in class. Is there an assessment at the end of this program?
There is.
Okay, sir.
We are going to be having assessments,
okay,
but that will be towards the end of the course. That will come up in February.
Okay, sir. So those who don't contribute in class, the assessment has already started. So that's what I just wanted to say, that you should be encouraged to contribute in class. So at least today now I've known Dr. Adekoya, and Ifeoma Nwako is the best.
Yay!
Yeah, that's the person that has contributed the most. So next lecture, I will expect you to contribute more. All of you should contribute more. So I'm concluding this lecture by saying that nutrition intervention or community nutrition is meant to solve the problems that have been discovered during nutritional assessment in the community. It's not just to carry out what a funder or somebody that has money just wants to do. It's supposed to be based on the problem in that community, either identified as felt need of the people or discovered objectively through research. We have learned today that there are different methods of intervening in the community. Could be health education, food diversification, food supplementation, food fortification. It can be treatment of cases. It can even be through monitoring. So any of these methods that we discover as relevant must be carried out. And then we should always remember to monitor our programs so that our objectives can be achieved, and evaluate at the end to determine effectiveness and efficiency. Thank you.
Thank you, Doc.
Bye.
Thank you, ma.
Sorry,
ma. Before you go, I've had some thoughts ruminating my mind.
Who is speaking?
Adeola, ma. Adeola Akonbi.
Okay.
Apologies, I joined the class a little late. I was on the road, so it was when I got home that I was able to connect.
Okay.
So the first one, ma, is about when you glossed over the fact that people that are obese do not need food supplementation. And I beg to differ, ma, because of eating hunger. You mentioned eating hunger yourself.
Yes.
So for the sake of eating hunger, they may actually be lacking some nutrients,
Okay.
which may be contributing to them adding weight. And it's important that their diet is supplemented as well, especially since they may be on restricted diet.
Okay.
That's number one. Then number two, ma.
Go ahead.
Thank you, ma. Then number two, ma, concerning food fortification. Sometimes the item may not be in the food at all. The item may not be in the food at all before it's being fortified. I think food enrichment has to do with the one that you are adding back to what was lost in the process of processing. So they add back the nutrients that was lost during processing. So I just wanted to.
Okay, Diola, thank you for your contributions. So because you came late, you didn't get that difference between individual intervention and community intervention. So I started by saying that nutrition intervention can be at individual level and can be at community level. So you can't go to a community and say, because as an individual, when I was trying to lose weight, I took some supplement. So you begin to give all of them supplement, you will kill them. So, because the issue is that individuals, you can assess, you are able to assess and say, okay, this person needs this kind of micronutrient, this person needs this kind of micronutrient. But if it's a whole community, your first focus, your primary focus, remember what I said is, you are looking at methods that will cut across, the methods that are most relevant to the particular problem on hand. So if you were talking about undernutrition, then, you know, we're not theorizing now. If it's just the theory, you would notice that the approach I use for the lecture, I try to be practical, because you are not undergraduate, so we are not just putting some things in your head. We want to be practical, and we want this course to be something that you can apply. And my topic today is community nutrition. If my topic was medical nutrition therapy, which is the next topic that I will take, then my approach will be different. And what you have said may be more relevant at that level. But please don't give micronutrients to people just because you discover that they are obese. Hold on, this is not an argument time. I'm just trying to.
I'm not arguing with you. I thought you were done. Sorry, ma. I thought you were done. No, I will never argue with you.
So just listen so that you get the point, and remember that the reason why you are attending this course is because you want to add to what you know.
You already know.
Yeah, you want to add to what you already know. Before I had my MSc in nutrition, I didn't know this answer I'm giving you. Before I started my PhD in nutrition, I didn't know some of the things I know now. But I already wrote a book on nutrition, and that even before I went for my MSc in nutrition. So we are adding more knowledge. And the particular point I'm stressing at this point is that unless you pick someone, even if that person has HIV and is cachectic, you can see that the person is wasted. What you have picked is HIV, not micronutrient deficiency. Unless you assess somebody and you are sure that this person has micronutrient deficiency, you are not supposed, proper nutrition practice should not give micronutrients just because it can be relevant. No, it can be relevant unless you are sure that it is actually relevant. Let me inform you that I've written a book on obesity in children. And one of the things that spurred me to write that book is the fact that micronutrient deficiency coexists with obesity in many people. It coexists with with obesity. So that was what infuriated me, that what kind of a thing is this? You see a child that is obese and you are thinking erroneously that this person is okay. Meanwhile, that person has eating hunger. So your second point, I'm not sure I can remember quite well, but I don't think that second point is there's any big issue about it. So, but that first one is just to say, please, unless you assess and you are sure that somebody has micronutrient deficiency, you see, let me tell you, in Nigeria, many people take supplements unnecessarily. And that's why when you go for education like this and you are trained in a formal setting, then you should join your voice to the voices out there that encourage discourage yo-yo bitters, and people are destroying their liver, packing up their kidneys and all of that just because they believe that they need one supplement or the other. That's not to say that some people don't need supplements. Some people need supplements. But let me also quickly add that sometimes or many times when people have micronutrient deficiency, the solution is not even taking supplements. The solution is eating well, eating a lot of fruits and vegetables, eating whole grains. That's the solution for many people. So when we take the next class and I talk about medical nutrition therapy, I will emphasize more on that. Thank you, Diola. Do you still have anything to say now? Your second comment, I wish I wrote.
No, it's fine now, Ma. It's fine.
That
it's fine,
second comment, what was that second comment?
It was about fortification and
okay, so
enrichment.
just hold it there. Let me quickly run through that. So food fortification, whether that nutrient is existent in the main food or not, as long as you are adding food or nutrients to food, that is fortification. In fact, if what you are adding to pap is granules, which is food, we still call it fortification. Okay, so enrichment is a situation where it's a physical, what do you call, processing has taken place in a food, and then you are now adding back. So that's why I said you made that second point well, and I don't think I need to say much about it. Thank you and have a nice evening. Bye.
Thank you, Ma.
Bye.
Thank you, ma'am.